Hello, I'm Dr. Charles Solomon, author of Handbook to Happiness and founder of Grace Fellowship International. GFI uses an approach to counseling known as spiritual therapy, a spiritual approach to counseling where the Holy Spirit does the therapy, as contrasted with psychotherapy through a human therapist. Depression is by far the most common complaint in counseling and also the most commonly mistreated. Even though it is usually not an organic problem, the general trend is to treat it as a chemical imbalance in the brain. If there is depression over time, it is true that there is a chemical imbalance. But which came first, the depression or the chemical imbalance? Since we have seen believers come out of clinical depression literally overnight, we choose to believe that the depression caused the chemical imbalance. As an example, there was a businessman who had been clinically depressed for 8 years and was on medication for that and for severe headaches. He had been hospitalized and was at the point where his psychiatrist told him that unless he improved in 2 weeks, he must have electroshock therapy. He had agreed to such a regimen when a mutual friend referred him to me. He came on a Monday looking like it would crack his face if he smiled. By the end of the second interview, he was ready to surrender all and take his place of crucifixion and resurrection with Christ in full surrender. The next day, at the third and last interview, he was totally free of depression for the first time in 8 years. The root problem is not the depression, but a life centered on self, while bottling up frustration and anger. My first book, Handbook to Happiness, and the second, The Ins and Outs of Rejection, clearly show how the Spirit uses the Word in setting captives free from depression and a myriad of other things. Assuming no organic cause of the depression, medication for a chemical imbalance is treating the body for a spiritual problem. Conversely, it would be just as bad to treat depression spiritually when there is a physiological cause of the depression. A case in point, a lady I saw appeared to be very depressed and sought counseling with me. After a session or so, I suspected an organic cause and consulted her physician, who said she just needed shock treatments. I gave him my professional opinion of his professional opinion, but didn't receive a fee. A week or so later, she developed more symptoms, and I directed the family to get her to a hospital. A CAT scan showed a massive brain tumor, which was malignant, and she had immediate surgery. It is my professional opinion that the vast majority of depressive symptoms have the self-centered life as the root cause, which the Holy Spirit easily and routinely resolves. Since the self-life is usually the root cause of depression, it is easily and miraculously dissolved and resolved as the Holy Spirit replaces the self-life with the Christ life. The most succinct statement of our message and ministry is in Galatians 2:20. I am crucified with Christ, nevertheless I live, yet not I, but Christ liveth in me. And the life which I now live in the flesh, I live by the faith of the Son of God, who loved me and gave himself for me. God used those first 5 words, I am crucified with Christ, to instantaneously transform my life in 1965. Sometimes he does it instantaneously, other times it's a gradual process, but either way, the Holy Spirit will transform lives that way and can transform yours as well. God bless you.